This thing on? Okay, so doing something a little different with this blog. I'm actually doing the vlog part freestyle. I don't have anything written right now other than a bunch of questions. So you might be wondering, what's it like to visit like an urgent care facility right now, or what's it like to go to a full-on hospital during the pandemic? And for that matter, what's it like to get a COVID-19 test? Well, unfortunately, I'm in a position to report on all three of these. So that's what this post is about. So this is medical treatment during COVID-19 pandemic, frequently asked questions. So we'll just dive right in here. So first of all, why would anybody want to go near a hospital right now? Unless obviously you have COVID. And in my case, I don't, but I was in a pretty bad accident. And although I put it off for a couple days, it became clear that I needed some medical treatment. So before I started making appointments, I asked a buddy of mine who's an MD, is this a really bad time to go to a hospital, right? Because, I mean, obviously he does every day for work and goes home to his family afterward. So I asked him about it, and he said, hospitals are really well run. They're kept very, very clean. They have very sophisticated protocols in place. And, this is an environment that's probably safer than, Walmart or something right now. Not to bag on Walmart or anything, but, these people take this very seriously. So he said you should have no qualms about it. So my wife made me an appointment at an urgent care clinic in Oakland, and I headed over there. Question number 2, is it hard to get an appointment? No. Right now, hospitals are not, well, it depends on where you are, but in our area, the hospitals are like really not doing much. I mean, they're sending people home. There's so many people avoiding these places, and California got such a jump on the pandemic with shelter in place that there's not a lot going on there right now. So she got me an appointment for like the next morning. Really easy. So is the traffic getting there and the parking easy? And the answer to that is yes. So our drive to Oakland was like record time. Honestly, my wife parked the car, so I don't know. She dropped me off. They aren't letting anybody in, obviously, in terms of like visitors or people accompanying you. Like it's like, leave your patient at the curb. So, and when we went into San Francisco for the second appointment, which I'll talk more about later, it was even weirder because like the Bay Bridge, which is normally any time of the day totally clogged up, it was just smooth sailing. And it was kind of weird to see a city like San Francisco kind of completely empty. I mean, this is normally, horns honking, cars everywhere, people flagging taxis. In a more suburban area like Albany where I live, the difference isn't that much from normal. Like you've got more people walking their dogs. But yeah, to see a city like that kind of emptied out was pretty crazy. So, question, is there a rigorous COVID-19 screening protocol before you can enter the building? So yes, there is. So the first place I went to, I was able to go through the lobby and up the elevator on my own. They had a big thing of hand sanitizer as soon as you get in there. So then I got up to a little table and there was a guy sitting there. So he took my temperature and made me use hand sanitizer so he could make sure I did it. And, just kind of made sure that I wasn't obviously symptomatic before allowing me to proceed. Next question. Will the person doing the screening make corny jokes to try to put you at ease? Well, that's going to vary, but in my case, the guy did. So he took my temperature and he said, 97.3 on your FM dial. And I thought, God, does this guy use that joke with everybody? But then I thought, it's actually pretty useful because if he says something like, this is like the new Alt 1053 or 1077 the bone. Well, then you know that you've got a high fever and you've probably got COVID. You probably would have sent me packing. Can you wear your own mask or will they provide them? So I had heard they were going to give you your own mask. So, but it's kind of a catch-22. Until they hand that thing out, you got to have a mask. So I'm like, well, after I've been in a hospital, I probably want to chuck whatever mask I'm going to have. So I wore my scuzziest, dirtiest mask. And sure enough, at the urgent care center in Oakland, the guy had me switch it out and gave me one of those cool, like, rectangular blue ones that hooks behind your ears. I kind of wish I'd kept it, but for the second place, they were offering masks, but I totally forgot. So again, I was wearing like my scuzziest mask, the one I dropped in the dirt. And so probably the whole time I was in there, I looked like some sort of derelict. But whatever. Okay, so next question. What social distancing measures will the doctors and nurses take, and what kind of personal protective equipment will they be wearing? So first of all, most of the time, there was only one person in the room with me. Oddly, there was a time when there were two nurses in there at the same time, which seemed kind of unnecessary. But that's all right. And the important thing, and I've read some articles on this, and I wish people understood this better so that hikers wouldn't scowl at me so much when I'm out there, is the risk of infection pertains to your proximity, whether you're indoors or outdoors, and how much time you're in that proximity. So if you're closer than 6 feet outside on a trail for like 1 second, you're not going to get COVID, or you're not going to give anyone COVID. Okay, so when I pass 10 feet away on some trail and I'm not wearing a mask, and some hiker looks over and scowls at me like I just sacked her ancestral village or cut off the wrong knee, I get a little testy. But yeah, two nurses in the room with me for 2 minutes at the same time, everybody wearing a mask, not worried about it. I did notice that nobody really spent too much time with me, for any protracted period, so I felt like it was very low risk. As far as PPE, of course they're wearing masks, and then the doctor was wearing like one of these big plexiglass face shields, kind of like what a riot cop would wear, except probably not quite as burly. It also kind of reminded me of the sneeze guard at salad bars, so they kind of have that thing going on. And of course, surgical gloves. And that was actually kind of funny because my hand is pretty bandaged up, and the doctor needed to check out my wounds there. And she's trying to take these band-aids off while wearing rubber gloves, and she just can't. So I'm like, here, let me help you out with that. And I'm like, wow, this is kind of funny. How often do you help a doctor out? I try not to do their job for them, but anyway, so again, I think everybody's pretty safe in that scenario. Okay, next question. What's the closest you had to get to anybody? So obviously the doctor was right in there dabbing this very cool, they call it meta honey, and it's like some kind of goop with enzymes in it that like eat up the bacteria that might be growing in your cuts. So it's sort of like, putting maggots in your wound, except smaller. So that was pretty cool. So she was kind of right up there, but again, not for very long. But the most uncomfortable I was when I went across the hall to radiology and was working with the guy taking x-rays, and he had to get right up close and like position me. And I say uncomfortable not because I thought he was going to give me COVID, because obviously he doesn't have it, I don't have it, and we're both wearing masks, but because he's asking me to like put my bad arm over my head and all these other horrible things. But that took a while, but it's a huge room, and he'd scurry behind the control console to not get radiated, obviously. So that was, that was the closest, because he's having to actually position, my arms and everything. Okay, so here's the next question. I get this a lot. How come every single member of the medical profession, except for the doctors, has tattoos now? I don't know, but they all did, like, to a person. And one of the nurses had like this really cool tattoo on her forearm of like a face, but it was like really well done, and it was kind of distracting. Because I kind of wanted to be like, hey, can you hold still a second? I just want to like peer into the eyes of this person staring out from your arm. But of course, I didn't want to waste her time or anything. But yeah, maybe it's just a value add. Kind of give you something interesting to look at during your treatment. Okay, here's a good question. Do you feel like you're taking medical resources away from COVID-19 people or people injured during protests or riots? Short answer, no. Again, there was nobody in there. Like, no one is scheduling elective surgeries right now. Nobody's going to the doctor. I mean, it's just starting to get a little closer to normal. But it was like a ghost town in there. I mean, there were more staff than patients by a huge ratio. It was totally dead in there. Just going through the different hallways and into the different areas, just a ghost town. So I feel like it's almost like when you're trying to support, your small business so they don't go under. Like, I was probably giving them some business, not that I would have chosen to, honestly. Next question, do you think it's in good taste to use terms like dead and ghost town under the circumstances? Maybe not, but, maybe we can all lighten up a little bit. Okay, next question. Is the service really quick now, since you're practically the only patient in there? Oddly, no. I thought this X-ray thing was going to be pretty quick, but I was there for hours. I mean, it's the same thing. They have to visit. Nurses come, they leave. The doctor comes in, doctor leaves, doctor comes in again. Then they get the X-ray thing. Then you wait for that. Then you go down there. You finally get that done. Then they got to get the pictures over to the doctor, and then the shift changes and whatever. So I was sitting on a pretty hard chair with no armrests for quite a while. I'm not sure why that is. Maybe they sent too many people home. Okay, here's a question. Do they still give you ridiculous orders, like taking your shirt off well in advance of the doctor showing up, so you have to sit there in the over-air-conditioned room for like 45 minutes shivering with no shirt on for no good reason? Yes, they still do. Next question. Is there any consequence whatsoever in completely ignoring the instruction to remove your shirt well in advance of the doctor actually showing up? Short answer to that one is no consequence whatsoever. So I sat there with my shirt on. I'd planned ahead. It had snaps down the front. Doctor showed up. Get the shirt off. Done. So it's important for patients to advocate for themselves, as always. Okay. Here's one. Get this a lot. Did everybody you talked to in each medical facility ask you if you smoke or have ever smoked? The answer is yes. All of them did. I got that question constantly. Just as I did last time I was in the hospital for a broken femur, where every time I turned around, someone else was asking me, do you smoke? Okay, next question. Why? I'm glad you asked, because I've asked this question too. And the answer is smokers just don't heal very well from this kind of thing. They just don't thrive. I mean, the smoking doesn't just wreck your lungs and your respiratory system. It systematically challenges your entire body and just puts it on the back foot no matter what it's trying to recover from. And we have a family friend who's like a fisherman and had some injury on the job and needed surgery and couldn't get a doctor to operate because doctors want good outcomes and they don't want to deal with patients that aren't going to heal. And guess what? The guy really didn't heal very well. So don't smoke. Okay, next question. Is it hard to schedule a surgery right now? So hopefully you've never had to schedule a surgery, but normally, I mean, it's quite a dance. I mean, you're talking to, uh, the special scheduler. Like, this is this person's full-time job constantly, and they're looking at slots, and it's really hard to fit in whatever. Well, this was a piece of cake. The orthopedist said, I think we should do surgery on you, and I agreed. Again, I'm not going to second guess the person. He went to medical school. I didn't. But it wasn't a close call, really, in my opinion. You should see the x-ray. But anyway, so I said, yeah, I agreed. He said, all right, well, we'll get that scheduled for you. Scheduled it for like early next week. And it was just really easy. So if you're thinking about, never mind, that's a stupid question. No one asked this next one. So, okay, forget it. Okay, here's a question. Do they make you get a COVID-19 test before you can have an operation? And the answer is yes. They actually will operate on you in a part of the hospital where there's nobody with COVID-19, and they just obviously want to limit any chance to exposure, and so they make you get a test. Next question, is it hard to get an appointment for a COVID-19 test for an upcoming surgery? Nope. Again, piece of cake. They put in the order on Thursday and had an appointment on Friday. So if you're looking to get a COVID-19 test and you're not getting any luck, just go get in a bad accident and injure yourself, and Bob's your uncle. Okay. Next question. Do you have to go to the same tent where all the symptomatic people are to get your COVID-19 test? And that's a great question, because obviously you don't want to be going to, a petri dish of COVID-19 germs or viruses, whatever. I'm not a microbiologist. Anyway, you don't want to expose yourself, obviously, in the same effort of getting tested. But the answer is no. They have a whole tent set up for asymptomatic people who need to get this test before going to surgery. So I thought that was pretty cool of them. Okay, next question. Do they really have a drive-through COVID-19 test? And will they really serve you microbrews on tap there? This is a two-part answer. First answer is yes, they really do have a drive-through COVID-19 test. But no, they don't serve microbrews on tap, at least not here. I think in Texas they're doing that, but maybe up in Oregon, but not in California. Next question. Here we go. That question about microbrews, is that kind of a sore subject? Yeah, it actually is. I wish you wouldn't bring it up. So right now, before the surgery, I can't have Advil. So I have to take either Tylenol or hydrocodone. And the hydrocodone has Tylenol in it. So I can't have any alcohol because I care about my liver. So even though a lot of people are advising me to treat my symptoms with beer, I can't. And I had to give up a 24-ounce crowler of, I think it was a 32-ounce crowler of Fieldwork IPA, because it was going to go bad in my fridge. So that hurt. I think that hurt more than my injury. Okay, so here's a question. Do they allow you to bring a pet in your car for the drive-through COVID-19 test? This was actually on my paperwork for the test. They specifically tell you, no, you may not bring a pet. If you have a pet in your car, they will turn you away and not do the test. Which kind of makes sense, right? Because if Rover is in the car with you, and someone takes like this Q-tip that's like a foot long and sticks it so far up your nose you're reminded of a sword swallower, Rover's probably going to take action. Rover's like, okay, that person's killing my master. This is my finest hour. I'm going to get involved here and save the day. So obviously nobody really wants that. No, you cannot bring your pet. The next question, did you want to bring your pet to the COVID-19 test? Well, my pet is a cat, so that cat is not gonna protect me. Needless to say, a cat has never protected its owner. I mean, they're totally useless. And moreover, I mean, I probably could have filed the work to have the cat registered as an emotional support animal, but only if they never met this cat. This cat's useless. I've been laid up since Saturday, and this cat will not get on my lap, will not come around. It's like I'm damaged goods. Cat's avoiding me like the plague. So no, I was not even tempted to bring the cat. Not even to punish her, because, she can't change her stripes. Okay, so next question. What was it like getting the COVID-19 test? So I had to sit in the back seat of the car, because I can't drive right now. And somehow I'd been led to believe the person was going to get into the car, but I think I must have been a little bit confused. So no, the person has you roll down the window, and then they lean in. And first they swabbed all over my mouth. So needless to say, I was not wearing a mask for this. But obviously the tester was wearing a mask, face mask, shield, whole thing. And then she said, all right, I'm going to go up your nose. And she sticks this thing, and she gets it like an inch into my left nostril. And she's like, oop, no, that one's a little tight. I can't do that one. And I'm like, great, I'm down to one nostril. What if this other one's tight? Then what? So, but that one apparently was okay. So she just went. And she's like, this is going to last for 10 seconds. And I'm really glad she gave me the countdown, because it was weird. I mean, it was like way in your nose. I don't know if you've ever had this happen where you're eating pasta or rice so fast that you get one that goes way up in there, and then it's like stuck like halfway between like your nose and your mouth. And it just sits in there and kind of hurts. It kind of hurts like when you hit a raw nerve with a drill, if you're having a cavity drilled without Novocaine, which is how you should do it, because it doesn't hurt that bad. But it's annoying, and you're like, oh God, I got pasta up my nose. And then you get a Kleenex, and you just blow your nose like super hard. And then you feel it go flying out of your nose, and you look down at it, and you're like, whoa, there it is. And it's just such a relief. So if you've ever had that happen, that's kind of like what it's like getting this COVID-19 test. But no, the thing was way in there, and she's kind of wiggling it around, and I'm kind of going, ah, oh, she's counting it down, and I'm like, all right, I got 5 more seconds. I can handle this. And then boom, it's over. So I mean, the whole test was over. Like we got there, we sat around for a couple minutes while they did whatever they were doing. But from the time like the swab came out till I was done, it was like 2 minutes, and we hit the road. Next question, how quickly did you get back the test results? It was about 15 hours. It was pretty quick. They called me this morning and let me know. Next question, do you have COVID-19? No, I don't. At least I've tested negative. And next question, did they give you the antibody test so you can see if you've ever had it? So I asked him about that. They said, we're not giving the antibody test. He said that they have so many, I can't remember if it was false negatives or false positives, but he said the accuracy rate of that test was about 50%. So it's just completely useless. So they wouldn't bother giving me that one. So next question is, would you have the surgery even if you have COVID-19? And I thought the answer to this would be no, that they'd reschedule. But no, given the severity of my injury and the need for the surgery, since it's not considered elective, they would move forward with the surgery, even if I have COVID-19. They just would send me to a different facility where they have I think they called it a negative pressure OR, where they can basically make it even safer. So I was kind of surprised by this. So I asked my buddy who's a doctor about it. And he said, oh yeah, they should totally operate. Like, just, grow a pair and just operate. Like, why should they be so worried? Like, they've got the PPE, this is the environment they work in. What's the big deal? Which is kind of funny, because I thought, like, if I didn't have it, it's because I would be at some special risk. But I don't know. I guess if you've got COVID-19 but you're not showing any symptoms, full steam ahead. So I got that to look forward to. Last question. Are you now considering getting surgery for your chronic dandruff now that you know the lay of the land? Probably not. I mean, it's a disgrace, the dandruff that I have. But I think I can kind of wait till after the pandemic before I have that scalp transplant. If anything interesting happens at my surgery, maybe I'll do another one of these. Otherwise, thanks for tuning in.